Last week I told you about the blood test that I never got. This week I want to tell you about the one I'm talking about, because if the GP had ordered it in the morning, my life would have been completely different right now. It's called a full blood count in the UK, and in the US it's called a CBC, which is a complete blood count. Same test, different name. It's the most ordered blood test in the world. It costs absolutely nothing, and it takes about 10 minutes. And what comes back can flag infections like leukemia, dehydration, internal bleeding, dozens of other things that you can't see and you probably can't feel. I'm Gary, and this is 2.6% Mind. Welcome back to Know Your Blood. What an FBC actually does. So an FBC actually looks at the cells in your blood, and there are three main types. You've got red cells, white cells, and platelets. Red cells carry oxygen, white cells fight infection, and platelets clot your blood if you cut yourself. When you get the results back, you're looking at roughly 8 numbers. Today I'm going to walk you through every one of them briefly, so the next time you see your own results, you'll actually understand what they're actually saying. The first 4 numbers. Number 1 is white blood cell count, the total number of your immune cells. That's the army. If it's high, your body's fighting something. If it's low, your defenses are low. Both directions really matter. Number 2 is red blood cell count. How many oxygen carrying cells you've got? Low means anemia and high means dehydration. Number 3 is hemoglobin, the protein inside the red cells that carry the oxygen. If you've ever been told that you're anemic, this means that this number is low. Low hemoglobin equals tiredness, breathlessness, brain fog. Number 4, which is hematocrit, and it's what percentage of your blood by volume is made up of red cells. It's another angle on the same story as hemoglobin. Number 5 is mean cell volume, and it's how big your red cells are on average. Small cells often point to iron deficiency. Large cells often point to a B12 problem. Same symptom, tiredness, completely different cause. This is the number that tells them apart. Number 6 is platelet count, the clotting cells. Too few and you bruise and bleed. Too many and you risk dangerous clots. Number 7 is neutrophils. This is the one I want you to remember, because neutrophils are the white cells that respond first to bacterial infections. They're the front line. They're the ones that run towards the fire. When neutrophils go up sharply, your body's screaming about a bacterial infection, often before you have any symptoms a person can see. Number 8 is lymphocytes. These tend to rise with bacterial infections. So if neutrophils are high and lymphocytes are normal, the picture leans towards bacterial. If lymphocytes are high and neutrophils are normal, the picture often leans to viral. It's not a perfect rule, but it's a real one. Now, every episode in this series ends in the same way, with one question that you can take to the doctors. And this week's question is, if you've had a full blood count recently, ask if you can have a copy of the results. Get them, keep them, build a folder, because next week we go deeper. We open up about white blood cells. Those are 5 different types, and I'll show you what they actually mean for your immune system. Thanks for watching and listening. Subscribe if you wish, so you don't miss the next episode. I'm Gary, and this is 2.6% Mind. Have a good week, and I'll see you next week.